Hi, my name is Alec Lee, and I'm the Director for Latin America Healthcare Research at Frontier View. Today, I'd like to bring you some key insights from our recently produced report, our semi-annual Latin America Healthcare Funding Outlook. Our funding outlook is the first part of our three-part series, the Latin America Healthcare Leadership Briefing. The other two components consist of the Key Regional Trends report and the Events to Watch report, both of which will be published over the coming weeks. In our healthcare funding outlook, we provide analysis on the outlook for healthcare expenditure in Latin America's top 11 markets over the coming 3 years. Specifically focus on the potential for out-of-pocket spending, private insurance funding, social security funding, and finally, government-financed healthcare systems. As I mentioned, today I'm going to bring you 3 key insights from our funding outlook report. The first is going to be related to the impact of the pandemic on healthcare spending as a percentage of GDP. From our early estimates, we're seeing a significant increase in healthcare spending as a percentage of GDP in 2020 as an outcome of declining economic growth, while we are seeing governments finance more and more healthcare services to address the pandemic. Looking at 2021 and 2022, we are not seeing that impact go away. In fact, we believe that with the recovery of private insurance spending, increased out-of-pocket spending, and governments having to continue to finance access to treatments for NCDs as well as access to COVID-19 vaccines, we will see a sustained growth of healthcare expenditure as a percentage of GDP. The implications of which will be that governments and private payers alike will need to be more cautious with the investments that they're making over the coming years when it comes to both providing access to primary care as well as innovative care within the tertiary clinical setting. The second insight I'd like to provide today is around how we are analyzing budgets for 2021. Now, what's interesting is unlike any other year in 2020, we actually saw governments have to inject significant funding into healthcare systems across the entire fiscal year. That means that budgets didn't look anything like they did at the beginning of the year once we arrived to December 2020. So when we look at 2021 budgets, we need to decide, are we comparing against the original budgets of 2020 or the modified budgets? And that really depends on what you're trying to understand. When it comes to looking at where governments are going to be allocating resources for non-COVID activities, our belief is the best comparison to make is to compare 2021 budgets against the original 2020 budgets. A good example of that here is with the CCSS, the Costa Rican Social Security Institute. Now, if we look at their 2021 budget overall compared to the original 2020 or modified budget, we actually see that it's declining in both cases. But if we look at the budget for materials and inputs, so medical devices and medicines, in fact, it's slightly increasing against both the original and the modified budget. Our third insight is with respect to how governments are going to manage budgets in 2021. We believe that much like in 2020, we're going to see most governments within the region have to inject funding across the year. I already mentioned that this was the case for most countries in Latin America in 2020. The example I'm bringing here is Guatemala, where we saw an injection of 15% of the original budget in early in the year, and later we saw another injection that was equivalent of 5.3%. What's interesting here is that because Guatemala actually has a presidential election in 2021, the Constitution mandates that the budget is the same for 2021 as it was in 2020. Therefore, these funds will actually be included again in the 2021 MOH budget for Guatemala. But overall, we anticipate that we will see funding injection after funding injection again in 2021 because most governments have failed to actually allocate funding for many things that we know will be necessary. For instance, many governments have underallocated funding for acquiring the COVID-19 vaccine, for delivering the COVID-19 vaccine, and for addressing the backlog of non-COVID patients for diagnostic exams as well as treatment. Finally, I'd like to bring you a bonus insight, and that's related to a key question that we've been receiving over the past 6 months, related to whether countries will be prioritizing the same therapy areas and treatments over the next 24 months, meaning through the remainder of the pandemic and the immediate aftermath. And the answer that we have looking at the 2021 budgets is that there's going to be a lot of divergence between budget priorities across public payers in Latin America. The example I'm bringing here is with respect to the Ley Recarte Soto funding, which effectively provides access to treatments for rare diseases in Chile, where we see a budget increase for 2021 against 2020, specifically due to the over execution of that budget in 2020. But if we look at the situation in the Dominican Republic, we see in fact that they are significantly reducing in the original budget for 2021 their allocation for attention of high cost diseases. Now, there are other examples of this, such as Colombia, who's continuing to increase funding for its National Cancer Institute, while several other countries throughout the region, including Peru, have actually reduced funding for their National Cancer Institutes. And again, that's in a situation where we've seen a significant increase in the backlog of patients getting cancer diagnosis and access to treatment. I hope you've enjoyed these insights, and we believe you'll enjoy it even more reading through our Latin America healthcare funding outlook. If you would like, we are available to debrief your teams on these views, and we look forward to continuing to supporting you in your strategic initiatives in the coming year. Thank you.